Unfortunately, we are continuing to see our Delta wave drive COVID-19 cases ever higher in Ohio. In the past week in Ohio, more than 3,000 cases of COVID-19 have been reported every day. Most frequently, we've seen higher than 4,000 or 5,000 cases reported on a single day. Although not the highest 24-hour numbers we have on record, these highs compare to figures that we reported during our winter surge and are more than 10 times what we experienced as recently as early July. The chart on our screen shows statewide and county rates as of yesterday. And you'll see from that the case rates, I'm sorry, my screen keeps changing. The screen that you're seeing right now shows our case rates as of yesterday. Later today, the graph will be updated with our website to reflect today's case rate data. We do that on Thursday. A county has a high rate of transmission, you'll recall, if it has 100 or more weekly cases per 100,000 residents. And that's according to the CDC's benchmark. Ohio's cases per 100,000 have been averaged over 2 weeks, and they now sit at well north of 400. In early July, that figure was close to 17. So we are now more than 25 times that number. All our counties have now more than 100 cases per 100,000 residents, and some are upwards of 1,000. When you look at the counties with the highest case rate per 100,000, they're primarily counties with lower vaccination rates. The top 5 counties where COVID is spreading have between 30 and 40% of their entire population having started the vaccine process, which is demonstrably lower than the statewide vaccination rate of all Ohioans, which is around 52%. Because every single county in Ohio has a high rate of community transmission of COVID, residents statewide should take precautions, most notably choosing to be vaccinated, but also choosing to wear a mask in situations where appropriate distancing simply can't be maintained. This added layer of protection is crucial, particularly as we fight the highly contagious Delta variant. As a result of this dangerous variant, we are seeing people of all ages getting sicker quicker and requiring hospital care. As of yesterday, the Ohio Hospital Association reported that statewide, about 1 in 8 patients in the hospital has COVID-19, and that about 1 out of 5 patients in the ICU is battling COVID-19. Just last Friday, those figures were 1 in 10 and 1 in 6 respectively. This is trending in the wrong direction. In rural Ohio, the figures are even more troubling. In our rural hospitals, 1 in 4 patients are hospitalized with COVID-19, and 1 in 3 in the ICU is battling COVID-19. Now, the chart on the screen, and I'll give that a second to come up. Is it still, okay, yes. So the chart on the screen shows hospitalizations and ICU admissions, and they were relatively stable in early July. The number of patients admitted with COVID hovered in the 200s, varying from 60 to 70 in the ICU and about 40 to 50 COVID patients on ventilators. Now, sadly, this has grown dramatically. COVID-19 hospitalizations and ICU admissions are now about 10 times what they were in early July, with more than 2,500 Ohioans battling COVID in the hospital right now. This includes more than 750 in the ICU and nearly 450 patients on ventilators. Now, unfortunately, it also continues to be true that unvaccinated Ohioans are far and away the COVID-19 patients filling our hospital beds. Data shows that from January to the present, less than 2.5% of those hospitalized were fully vaccinated. This is a hospital pandemic of the unvaccinated. Now, I want to reiterate that what we are seeing right now is very troubling and is very reminiscent of our winter surge before vaccines were even available. Now we have vaccines, including the Pfizer vaccine, which is fully approved by the FDA for those aged 16 and up. These remarkable vaccines can help prevent severe illness and death from COVID-19 and will prevent dangerous variants from taking hold in our communities. But we all need to work together to get a higher rate of community protection. We all need to choose to be vaccinated. Vaccines, along with masks, also help keep our kids in school in person, learning 5 days a week, which has long been our goal. As many schools across the state have started their academic year and have staff and students who are now being quarantined, we've clarified our quarantine guidance for exposure in the K-12 classroom. The bottom line is that there are 3 paths that will allow students to avoid quarantine and to continue attending school in person after exposure in the classroom, as long as they don't have symptoms. Now, first, if a student or teacher who's exposed to COVID-19 is fully vaccinated, that person will be able to forego quarantine. Next, if a school requires key prevention measures, the exposed staff or student will not have to quarantine. And you'll remember these include, first, requiring masking of all students and staff regardless of vaccine status. 2, maximizing physical distance with at least 3 feet between desks. And 3, have documented COVID-19 prevention policies in place, such as the identification of individuals experiencing symptoms, strategies to increase ventilation, protocols for cleaning, etc. And finally, in cases where the school does not require masking, any student or teacher who is exposed to COVID can still avoid quarantine as long as they, as the person exposed, were masked and maintaining a distance of 3 feet from others. Now, it's important to keep students healthy and learning in person as much as possible, but doing so in the face of unprecedented numbers of children contracting COVID-19 and other respiratory viruses really requires us to take extra measures like masking in school, particularly given what we're hearing from children's hospitals across the state and the country. Nationally and statewide, children's hospitals have sounded the alarm. In a recent full-page ad in the New York Times and the Los Angeles Times, which was also shared widely on social media, the presidents, CEOs, and executive directors of the nation's children's hospitals said that, quote, tragically, rising numbers of COVID-19 infections among children, surging cases of respiratory illnesses such as RSV, and the pandemic's ongoing impact on mental health are pushing our children's hospitals to capacity. Combined with significant hospital workforce shortages, the pediatric safety net for all children is being threatened in unprecedented ways, end quote. Today, I'm joined again by 2 physician colleagues. First, to speak about children in our hospitals statewide is Dr. Hector Wong. Dr. Wong is an ICU physician and head of critical care at Cincinnati Children's Hospital. Dr. Wong, that statement from the Children's Hospital Association mentioned that there are significant hospital workforce shortages. Why are hospitals short-staffed right now? What's behind that?
Thank you, Dr. Vanderhoff. So I think the primary reason is that healthcare workers are exhausted. We have been at this in the front line of this pandemic now for about a year and a half. And I think people are just exhausted, emotionally drained, and many have chosen to leave the workforce in healthcare. And that coincides with being busier in the hospital. I think those two forces are leading to challenges in looking after patients.
Thank you, Dr. Wong. With the unseasonably high number of RSV and other respiratory illnesses that are happening among our children in Ohio now, as well as rising cases of COVID, we've got flu season right around the corner. What recommendations would you have for Ohio's families?
Sure, thank you. So first, I'll start by saying that the sort of unusual timing of RSV and other respiratory illnesses, at least for me, it's not a surprise. Our colleagues in the Southern Hemisphere saw a very similar thing during the tail end of their summer, and that typically signals what we're going to see. So I'm not surprised. So, I think I have multiple suggestions. The first and foremost is what you were speaking to earlier, is get your kids vaccinated. Right now, kids 12 and above are eligible for the COVID vaccine. It's a safe vaccine. It's a very effective vaccine. I think I heard you say it's a remarkable vaccine, and I couldn't agree more. And hopefully in the next couple of months, we will have an EUA for kids less than 12. So I would encourage people to strongly consider getting your kids vaccinated, because that's the single most effective tool that we have to combat this pandemic. Flu season is coming around, so let's not forget about that. I think you have the opportunity to get kids vaccinated for flu as well. Beyond that, I think just some common sense approaches. Keep your kids away from people who are sick. Keep your kids away from crowded areas where there may be other people who are sick. If your kids are sick, that's the time to keep them home from school more than ever. And then the last thing I'll mention is, I think, actually two more things. One is masking. Masking in indoor spaces, I think, is a really, really powerful tool, particularly in schools. So I couldn't advocate for that more strongly. And then finally, I would say is check in on your kids in terms of mental health. Check in on their emotions. I mean, many of us adults aren't doing well with this, so I think it's a safe bet to say that our kids aren't doing well either. So please check in on them. I think sometimes just a simple act of saying, how are you doing? Let's talk about it, can go a long way. And please be cognizant that the mental health impact of this pandemic on kids is underappreciated by many. It's as big a factor as the effects of the virus.
Thank you, Dr. Wong. I think because children often do better than adults with a COVID-19 illness, many people forget that our children really can become sick with COVID, and severely so, especially with things like the multi-system inflammatory syndrome in children, or MISC. Based on your experience as an intensivist in a pediatric hospital, can you share a little bit with us about your perspective in terms of the real risks of serious illness that children face from this virus?
Sure. So, I mean, beyond MISC, kids can get the same things that we hear about in adults. They can get respiratory failure, end up on ventilators, end up on things like ECMO, which is a heart-lung machine. They can get multi-system organ failure, septic shock, really the same things that you hear about adults. What's a little bit different now, to dovetail to what you were saying earlier, is I think something of a silver lining about a year ago was that the kids were getting infected, but weren't getting particularly sick. That's starting to change now. It feels different now. A year ago, we would have a handful of kids in the hospital who were with us for other conditions and happened to have COVID. Now what we're starting to see is kids in the hospital, including the ICU, who who are there because of COVID, with things like respiratory failure and other effects. So it feels different. Biologically, why that is, it's speculation, perhaps something related to the Delta variant, but clearly what we could say a year ago that kids weren't getting sick from COVID, we can no longer say that. We're hearing that across the country, and we're starting to feel that locally in Ohio.
Thank you. You know, there are some parents who are concerned about consistent masking in children, with fears that wearing a mask could cause harm to their child. What information can you share with parents about the safety and the importance of wearing masks, especially in school?
Yeah, I mean, globally, I'll say that masks are perfectly safe, and I'll speak to a couple of consistent themes that I've heard. So one is that masks can cause you to have low oxygen and have carbon dioxide retention, and that's simply not true. These masks, air flows through these masks very easily. Carbon dioxide and oxygen are very small molecules. They pass through that freely. So there is no risk of having low oxygen and carbon dioxide accumulation from masks. There was a study out there that suggested that. I think it's important to know that study was retracted. From a practical standpoint, please remember that surgeons, operating room staff, us folks in the ICU, we wear masks for 10, 12 hours at a time caring for patients, and we're not getting oxygen deprivation or CO2 accumulation. Another one that I've heard is that by wearing a mask, kids who have COVID or people who have COVID will rebreathe the virus and stay sick longer. That's just not how biology works. So there is no increased risk of having ongoing infection from a mask. I know parents have some concerns about emotional well-being in kids due to wearing masks, and there really aren't any data to refute or support that. I would balance that with what we know are the mental health effects of not being able to be in school, being quarantined, not learning. Those are really clear. So I think on balance, the concerns about mental health because of masks are far outweighed by the concerns of missing school, being quarantined, not being with your peers. And if I may add one other thing, I think with respect to masks in school, I think we need to shift the conversation. And rather than get into whether masks work or not and safety around masks, I think we need to shift the conversation to what's most important. And I think what's most important is, as you said earlier, is keeping kids in school 5 days a week in person learning. I think that the majority of us could agree that that is the primary goal. And let's shift the conversation to that and say, how can we best get there? And so I would say masks and vaccination are two of the most powerful tools to get to that common goal.
Thank you very much, Dr. Wong. Next, I'm joined by Dr. Brian Taylor, Inpatient Medical Director for Central Ohio Primary Care Hospitalists. This is a large group of hospitalists. Hospitalists are physicians that work in the hospital, serving as the primary attending physician for hospitalized patients. And his group works at 4 Central Ohio hospitals. Dr. Taylor, I imagine that you've been seeing COVID-19 patients in the hospital for quite some time now. Are there any trends that you're seeing among those hospitalized with COVID now? Do they have underlying conditions? Are they vaccinated? What's the perspective that you're able to bring?
Sure, thank you. It's funny, I was taking some notes. Like Dr. Wong said, one of the trends that we saw a year ago was probably some more incidental cases of COVID. Someone came in with one medical issue, and in testing them, we happened to find out that they do have COVID. We're definitely seeing a lot more primary diagnosis of COVID. As you've already stated very well, the vast majority of our patients in the hospital with COVID are the unvaccinated. Depending on the hospital, it can be anywhere from 80 to 90% of the patients who have COVID are unvaccinated, but in the ICUs, it's still holding above 90%. Our group today, we're probably going to see a little bit more than 400 patients at all 4 hospitals throughout here, Columbus, and more than 60 of those patients have COVID. And that's another thing I was writing down as a note, that data is exactly right that you're providing about 1 in 8 patients, because probably 1 in 8, 1 in 7 of our patients are going to be patients with COVID, which is a very high number. We probably don't have any other diagnoses that are that high. As far as medical issues, we're definitely still seeing people who have underlying immunosuppressed states that are probably predisposing them to be at higher risk. People with diabetes, people with obesity, but we're also still seeing the young and the well. We have plenty of folks that are in their 20s and 30s and 40s who are on oxygen or in the ICU even, and don't have any past medical issues. So that's a trend in the scary way, in that you don't want to see people that don't really have those risk factors that sick.
Thank you, Dr. Taylor. I shared earlier that COVID-19 hospitalizations have risen significantly statewide just in the past weeks, and they've continued to rise. We heard the plea that came from our pediatric hospitals nationwide, and we've heard repeated here in the state that some of them are reaching full capacity. Tell me a little bit about the atmosphere that you and your colleagues are seeing in the hospitals, and what would you want to share with the public who doesn't see what you see inside of the walls of the hospital?
Yeah, I think Dr. Wong stated it really well earlier as well. And the part of what I would definitely want to add on is that everybody that works in the hospital, whether it's someone in a white coat, whether it's someone who's doing transport, physical therapy, everyone's there to help patients. They're trying to help people get better. They've been working really hard for the last 18 months. They really appreciated all the support that we had back in March and April of last year. They understood and appreciated the sacrifices that the public was making by staying home, by masking, by social distancing, all those things. I think now a lot of folks are frustrated. The volumes are high. We want to make sure we're taking the best possible care of the patients that we're seeing. But it is frustrating to see a large number of patients who are unvaccinated and are sick with COVID. And a lot of whom, when I talk with our docs and when I talk with patients as well, they do regret that decision. They do wish that, all things being equal now, understanding what they understand, that they would have gotten vaccinated instead.
Thank you, Dr. Taylor. We hear that people on that theme of vaccinations are sometimes hesitant to get the vaccine because they're worried about side effects. And will those side effects be worse than those of having COVID-19 itself? Having treated many COVID-19 patients, what would you say to the people who are worried about side effects from the vaccine versus the virus?
That's a really good question. So I'm going to start with my own personal experience. I've been fortunate enough, to the best of my knowledge, I've not gotten COVID. I have been vaccinated. Like most people, my first shot had a bit of a sore arm, and that was it. Second shot, a little bit, maybe fever and chills, was tired, still went to work, felt fine. That was it. When I look at our average COVID patient in the hospital, at least, they're on oxygen, they're struggling to breathe. They're in the hospital for maybe up to a week or so. A lot of them have longer term health issues. If I had to weigh those two things against each other, it's not really a contest about which risk I would rather take. I understand there's people that are concerned about the things that we don't know. And I think that's just as true. Sorry, the things that we don't know about the vaccine, about long-term effects, that's just as true as for COVID. There's a lot of things that we don't know how this will affect people 20 years from now, 30 years from now. There are viruses like varicella that, I had chickenpox as a kid. I will potentially be at risk for getting shingles as an adult because of its reactivation. So we don't know how COVID will affect people. So I totally understand the concern about the side effects. As someone who lived through the side effects, I would tell you I'll happily get my booster when it's something that's recommended for me, even if I have some of those same symptoms. It's definitely worth it.
Thank you very much.
Dr. Vanderhoff,
Yes.
if I may just add on to what Dr. Taylor just said, those side effects that he described during his second vaccination, I had the same thing, and that's to be expected. That is your immune system at work, generating an immune response to the spike protein. That's inflammation. Inflammation is your immune system at work, and that's creating a memory so that when you see the virus, your body is ready to take care of it. And one more thing around long-term side effects of the vaccines. For the majority of vaccines, I think you need to put into context what long-term means, right? And so for the vaccinologists or the vaccine trial people, their experience is usually if you're going to see long-term effects, you're going to see it about after 2 months of the vaccine. And so we've had a long experience now with these vaccines, and it has a very, very favorable profile. And there's a lot of myths out there that the viral RNA is going to integrate into your genome. No, it's not. That's just not the way these vaccines work. So anyway, I'm not sure if that was out of line, but I just wanted to build on
that was excellent.
the topics that Dr. Taylor was talking about.
No, thank you very much, Dr. Wong, and also thank you, Dr. Taylor. We all need to do our best to prevent the spread of COVID-19, to allow our hospitals to be able to continue to give necessary care to Ohio's children and adults in need. COVID-19 hospitalizations are happening primarily among the unvaccinated, and Ohioans can help relieve this pressure on our hospitals heading into the future by choosing to be vaccinated. COVID-19 vaccines are our safest and most reliable means of protecting yourself from COVID-19 hospitalization, and thus assuring that our hospitals have the beds and the personnel to treat us when needed. Because as more Ohioans gain robust immunity through vaccination, we can reduce the opportunities for this virus to spread, to mutate, and inflict serious harm. We've all heard today how busy our hospitals are, especially our children's hospitals. To help curb the spread of COVID-19 and other respiratory viruses, which are pushing our children's hospitals to capacity, we strongly encourage schools that are not already doing so to mask. Also, remember that if you are concerned that you might have COVID-19, there are many options for testing. In addition to being able to get a test at many pharmacies and community providers, we have also partnered with many of the state's libraries and local health departments where you can pick up a free rapid Binax Now test, which is administered from the comfort of your home with the help of a telehealth provider. Keep in mind that the demand for testing right now is high, so call ahead to make sure a test is available at the location that you plan to go to. Finally, as we approach the Labor Day holiday, I urge Ohioans to follow safe COVID practices. If you're in an area where social distancing isn't going to be possible and you're not vaccinated, you should definitely wear a mask. And you should strongly consider one even if you are vaccinated. Please help us prevent the spread of COVID-19 and other respiratory viruses this holiday by making choices that protect you and the people around you. And now, Alicia, I think we can take questions.
Thank you, Dr. Vanderhoff. Our first question comes from Josh Rultenberg with Spectrum.
Hi, this question is for Dr. Vanderhoff. Dr. Vanderhoff, when I asked you about mask mandates on August 23rd, you said, quote, "At the end of the day, no mandate is going to be able to have an impact without the people of Ohio being behind the measures." With that said, if enough Ohioans are not willing to get the vaccine or wear masks, do you think the best way to get us out of this pandemic is for a statewide mask mandate or vaccination policy to be put in place and for there to be enforcement on both?
Well, again, we're part of a very wonderful democracy. And in that democracy, it really, at the end of the day, always depends upon the will of the people. And what we need to get through this is for all of us to recognize what I and my other medical colleagues have been saying now for weeks and are repeating here today. There are ways that we can, in fact, protect ourselves, our children, our schools, our communities from being upended by COVID-19. And that way begins with vaccination. We as a state, we have not been mandating vaccines. We've been strongly encouraging those, and to wear a mask to add a layer of protection to what you're doing each and every day. And this is especially important in our schools. So yeah, what I said then, I think holds true today. Our guidance really relies upon the people to get behind it.
Thank you, Dr. Vanderhoff. Our next question is from Spencer Hickey with Hannah News.
Thank you. And this could be answered by any of you. Could you talk about what high hospital capacity or full hospital capacity could lead to in Ohio in the near future based on what other states have seen?
I'll open that up and then I'll turn to my two colleagues who actually work in the hospital environment. Clearly, if we look across the nation and even across the world, hospitals can become overwhelmed. Now, we've been very fortunate here in Ohio. We have remarkable healthcare systems and healthcare providers, professionals who have worked tirelessly to make sure that those vital resources are available to us. We also have a very strong system that the state coordinates that allows our hospitals to work collaboratively, to shift resources, and to assure that their people are getting timely access to care. But no system is inexhaustible. And we heard the plea today that came from the pediatric hospitals across the country saying, look, we have to take this seriously. We're in a very, very serious wave of COVID-19, and we need people to roll up their sleeves, get vaccinated, and we need them to wear masks when they are going to be out among people, particularly in indoor environments. So it's, I think, very serious, but no, fortunately, we are not in a position yet where we are having to turn people away from care, but we want to avoid that ever happening. I'll turn to my colleagues. Dr. Wong, perhaps you could start, and then Dr. Taylor, you could follow.
Sure. I mean, I think that was really well put. There's not much to add to that. In the case of children, we're worried that if we're beyond capacity, that we can't attend to the needs of kids. As an example, we are the regional trauma center for kids. It would be awful if a little one was in a motor vehicle accident, as an example, with major trauma, and we had no ICU space for them. We're not there, but that's an example of one of the fears that we have. That's an example. Pediatric trauma care is very specialized. We're the resource for the region for that, and it would be a tragedy if we weren't able to meet those needs, as an example.
Dr. Taylor?
And I think ours is similar. There's obviously a lot more adult hospitals in Central Ohio, but there are still hospitals that are able to take care of higher acuity patients that need to come to certain hospitals. And if beds are filling up at one of those higher acuity hospitals, it might be harder to get those patients in, and that can cause a backup in the system. It's funny, I had a patient earlier this week who I had to reassure her, you do need bypass surgery, cardiac bypass surgery. Right now, I think we'll be able to still get you in. But if the volumes continue to go up, they might have to look at delaying surgeries again. And that's a necessary surgery. It's not something that has to happen right away that day, but it should happen as soon as possible. And then a really practical thing, I think most people who've ever been in an ER are aware of, it's not an enjoyable experience being in an emergency room for such a long time. They're doing their best to get you in and get you back home or to admit you if they need to. But you see longer wait times in the ER when the volume is getting higher and the capacity is getting tighter in a hospital. So those are, to me, really practical things that maybe people wouldn't realize is occurring, but it is occurring as we're getting in these higher numbers.
Thank you, doctors. Our next question comes from Dan DeRose with WOI.
Good morning, gentlemen. Thanks for taking questions today and making time for us. I want to talk about people who are under the impression maybe they had COVID, they tested positive January, February, March, April of 2020. So we're talking more than a year ago. And they've decided, well, I don't need to get vaccinated. I have the natural antibodies from having COVID. How long do those antibodies last? Should those people roll up their sleeves and realize, is the vaccine better than natural antibodies at this point, now that it's been a year since you tested positive? And how long are they protected?
Well, thank you. That's an excellent question, and I'll lead off, and I'll tell you it's one that I get fairly regularly. First, we have said for a long time that there's no question that you do get benefit, you do get protection from the immunity your body develops after you've had an infection. And you'll recall, dating way back to last winter, we were able to tell people, look, after you have had an infection, you're very unlikely to get reinfected within the first few months. And so we had asked people to factor that into even when they were receiving their first doses of vaccine back then when things were tight. But we've learned more about the virus and more about vaccines since then. And it's increasingly clear that even if you've had a prior infection, you benefit from getting a vaccine. In fact, adding a vaccine onto that boosts your immune system by many, many times, raises your antibody levels. And for me, more importantly, I think it has been shown to boost or activate your cellular immunity. You may have recalled from past press conferences, I've talked about that as being your learning and memory immune system. So very, very important and an added benefit. But I'll add one more thing. We now have a study that was reported out in Mortality and Morbidity Weekly Report last week, showing that you're 2.5 times more likely to have a reinfection with COVID-19 if you're relying just on natural immunity compared to if you've gotten the vaccine. So can you get a mild illness if you've been vaccinated? Yes, you can. But you're 2.5 times more likely to have that happen if you are relying on that natural immunity. And of course, the track record of these vaccines at keeping you out of the hospital and preventing you from dying are stellar. And so, weighing that, to me, vaccine seems to be the superior choice, but also an added benefit, even if you've had a past infection. I'll turn to my colleagues to see if they'd add anything or any additional perspective.
Brian, I can start. I mean, this is one of those issues that's, like I like to say, it's both complex and complicated. And that reflects, the nuances of the immune system and the heterogeneity of how people respond to natural infection. What I would add to Dr. Vanderhoff's excellent comments, with I agree wholeheartedly, is that when they've done studies comparing the response of the vaccine to the response to natural infection, on average, the response, the immune response to the vaccine is an order of magnitude greater than to natural infection. On average, people are very different. Our immune systems are very different. So there's a bell curve and there's going to be outliers on either end. But on average, it's an order of magnitude greater with the vaccine. So I think that those are pretty good odds, I think, that support the strategy that Dr. Vanderhoff was alluding to or speaking to.
Yeah, and in our group, we had some people that early on, unfortunately, did get COVID back in March. As soon as the vaccine became available, they got vaccinated. Everyone in our group has gotten vaccinated, whether or not they've had COVID in the past or not. I've definitely seen patients who've had COVID, recovered, and then gotten COVID again. So yeah, there's no one I would tell if you've had COVID before, you don't need to worry about getting vaccinated. I would encourage anyone who's had COVID before to still get vaccinated.
Thank you, doctors. Our next question is from John London with News 5.
Yeah, Dr. Wong, we run into people all the time who believe children handle COVID well and they have mild symptoms and they recover quickly, and that the concern about this is all overblown, and that those who are very sick are the ones who are health compromised. I wonder if you would share with us what you are seeing in the ICU right now. Maybe if you're able to describe some ages and conditions, and are what the ones you're seeing, are they otherwise healthy kids or not?
Yeah, thank you, Mr. London. So I really cannot share specifics because of HIPAA and privacy concerns and respect for our families. The best that I can tell you is that what you said earlier in your comments, I think was quite true a year ago. But now it feels different. Now we're starting to see kids coming into the hospital and into the ICU who are otherwise well. As far as we know, they have no comorbidities and are getting sick from COVID. It feels very, very different. And we're hearing that across the country from our colleagues. I was on with some colleagues from the West Coast earlier this week, and they have a lot of sick kids in their ICUs among them. So the best that I can tell you is that somebody who's been in the ICU for almost 30 years now, it feels different. And the silver lining a year ago was that we really didn't have anybody in our ICU with COVID, or very infrequently, and now we're seeing them more frequently. This is real.
Thank you very much, Dr. Wong. Our next question is from Jim Province with the Toledo Blade.
Thanks again for doing this, Dr. Vanderhoff. I know in the past that you voiced some optimism that Ohio's rate of vaccination might help temper spread. But given the fact that the spread is happening this rapidly, this early, even before people move indoors with the cold, could this winter be worse than last year?
Well, thank you for that question. And it's right on the money, because I think what we're seeing now tells us just how important it is for all of us to think about vaccination, all of us to make the decision to roll up our sleeves and get vaccinated. Look, this wave is having a very serious impact on our hospitals. That means every one of those patients, because hospitals don't admit people who aren't very seriously ill anymore. That means all of those people are very seriously ill, and some of them are going to die. Nearly all of them are unvaccinated. If we project forward and we think about what will this look like when we get into December, when we get into January, we have to really ask ourselves, if we're unvaccinated, do I want to take that chance? Particularly when we now know, and just looking at Ohio's data and hearing what we've heard from Dr. Wong about our children's hospitals, this is not restricted to people of very advanced age anymore. We're having people of all ages in our hospital beds, of all ages in our ICUs, and sadly, of all ages dying. And we can prevent that, and we can protect ourselves from that by a vaccination. So it again just points to ever more the importance of vaccination as we look ahead and we think about how blessed we are to have this truly remarkable medical advance in our hands. I don't know, colleagues, if you think that there's anything you'd like to add, but please do.
Yeah, thanks. I mean, I couldn't agree more. What I would like to add is let's remember influenza and that there is a very effective vaccine against influenza. Last year, one of the fortunate things is that the influenza season was incredibly mild. I mean, it's the mildest I've ever seen in my time. And so we were really, really lucky because we were worried about sort of having a dual surge of patients with influenza and COVID. I don't think we fully understand why we were so lucky. I'll take it, but don't really understand why we were so lucky. We may not be that lucky again this time around. So I would include widespread vaccination for influenza, along with what Dr. Vanderhoff was saying, because that would be potentially overwhelming for hospitals if we had waves of patients with both COVID and influenza, and also perhaps a combination of one person being infected with both. We haven't had very much experience with that, and quite honestly, I don't want to find out what that looks like.
Yeah, and I think the one piece I would add with everything that I agree with, that the importance of vaccination, and then like you had said earlier, Dr. Wong, wearing masks, following the science. I think those are our keys to staying out of having a worse winter than we had last year. The piece I want to say about vaccination, or two parts, is if people want to know how they can help us in the hospital, that is number one of what they can do. Very close number two is wearing masks. But what I would also say about vaccination is I understand that us just telling people to get vaccinated probably isn't enough, or maybe not even the right approach. People have questions. They're concerned. They're not resistant. They're just hesitant. I think we physicians need to make sure we're open and we're listening to the people that have these questions and sit and take the time to answer them. So I would encourage anyone who's hesitant to find a doctor that they trust and have a conversation with them, ask them the questions that you want to ask. And I encourage any doctor to sit and just listen and answer those questions without judgment, and just help, because we know what the science says. If we answer the questions, I think people will come to the same conclusion.
Thank you very much, Dr. Taylor. Our next question comes from Joe Ingalls with Ohio Public Radio and Television.
Thank you, doctors, for doing this phone call. My question is, with these booster shots that are supposed to be coming online later this month, a lot of people are saying they really feel like they need a booster because it's been a while since they had their last shot. And we know that a lot of people are interested in getting those. What kind of preparation is in place right now? What are you doing, and what will the guidance be as far as getting those boosters?
Thank you. Another excellent question. First, let's talk about the process for boosters getting approved. While there has been a recommendation that has come out of Health and Human Services for a future booster, there are two very important regulatory and scientific steps that still need to play out. One is review by the FDA and its advisory committee, which is populated by scientists and physicians from the National Institutes of, from the, now I'm forgetting the name of the organization, but very prominent scientists. So that's very, very important, because they will sit down, review the data, and make a determination about what the science is telling us about a booster at this time. If they give the green light, the ACIP, the Advisory Committee on Immunization Practices, will then review and make guidance and recommendations regarding a lot of the specifics based on vaccine safety and also the data that's available, including timing of doses, et cetera. We as doctors and we as a public health department can't make recommendations or guidance in advance of that. We have to await that direction and that guidance. And it's the right thing because it is awaiting science and medicine to provide us with the best information. That having been said, at a state level, we have not only been scenario planning, but we have also been working actively with all of our partners to assure that we stand ready to go with a recommendation when that recommendation comes forward. So we don't have special insight into how that process will play out because it is a process and one that will play out in a very transparent way, just as it has in the past. So that's really the preparation in place. We continue to anticipate that boosters will be coming, but we're not able to offer any more insight than others would. I'll turn to Drs. Wong and Taylor. Anything that you would add as doctors or professionals? Anything that you would add?
I would just say, I think I would agree with everything you said regarding boosters. We just need to wait on the data and the science. I think eventually, rather than calling it a booster, it'll be part of a vaccine series, right? Just like we do with many other vaccines. What I do worry about, with all due respect to the question, is I worry about a lot of focus on the booster and taking away from what is our primary challenge right now, is getting more people vaccinated with the regular 2 doses, right? I think that's our biggest challenge right now, and that's what's going to have the most impact at the moment. So I'm not trying to say that the boosters aren't important. I just don't want that to detract from what should be our main goal right now, is getting more people convinced that getting vaccinated is the right thing to do.
Yeah, and one thing I'd add is, and this has been stated by a number of national experts, including Dr. Paul Offit, who is a well-recognized leader in the vaccine field. Our current vaccines are continuing to do an exceptional job. There's been no diminishment at all in their ability to protect us from the primary endpoints of respiratory vaccines, which are to protect us from serious illness, hospitalization, and death. And that continues to be the case. So they're still doing a very, very good job, and people should not have anxiety about that. And Dr. Taylor, I jumped in and may have cut you off. So please add anything that you might.
No, I actually agreed with everything you guys said. I was just gonna let that one go.
Thank you very much, doctors. Our next question is from Tom Jackson with the Sandusky Register.
Are you guys disappointed the FDA isn't moving more quickly to approve vaccinations for younger children?
Well, I'll start that, and then perhaps give Dr. Wong, as a pediatrician, a chance to jump in. Look, of course, I think we're all eager to have a vaccine available for our children 5 to 12 as soon as is possible. But we also believe that the process so far has worked extremely well in assuring that we have safe vaccines with the right dosing determined, and we want the process to work appropriately and for the time that is needed to be taken. So while we want it to be done expeditiously, we don't want it to be done in a rushed manner. And so far that has not occurred. So while yes, we're eager, I think that they're doing things exactly as they should. And Dr. Wong, anything you'd add as a pediatrician?
Yeah, I mean, I couldn't agree more. I mean, I'm anxious to see the day when our little people can get vaccinated. But I think the FDA is doing its job. They're being very, very careful. They're not cutting corners. I would go so far as to say the fact that it seems to be taking a long time, I think should be reassuring to the public that the FDA is not cutting corners. It's doing its due diligence. It's following its protocols and making very, very sure that this will or will not be something safe for younger kids. So I couldn't agree more. I think it should actually be reassuring.
Thank you. Our next question is from James Pilcher with WKRC Local 12 and Cincinnati.
Good afternoon, doctors. Thanks for taking my message or my call. What do you say to those who are planning to travel to have parties? And Dr. Wong, I'm sure you're aware, down here in Cincinnati, we have a really big party planned for Sunday for the fireworks. Mass gatherings, parties, travel. What advisories do you give those with these numbers the way they are?
Well, thank you for that question. I'll open somewhat echoing my closing comments before we open for questions. Anytime we approach a holiday, especially during a time where we're worried about a very contagious virus in our midst, we have to be thinking about what that means for our activities and our gatherings. Fortunately, Labor Day is a holiday that falls when we can do an awful lot outside. And outside is always safer than inside when it comes to these respiratory viruses, particularly when it's warm and sunny out, as it's likely to be this holiday weekend. Nevertheless, we still have to be mindful when we're outside with other people about how close we are to each other. And if we're able to maintain good distance from one another, a couple arm lengths, we're probably pretty safe. But when things get tighter, we need to wear a mask, because then we just don't have the same benefit of the distance and the air taking care of things. The same is true if we go inside. If you're going inside among people who you're not normally with, you really need to put on a mask. And while the risk for the vaccinated is dramatically less, our vaccinated folks still need to be thinking about that mask issue as well, because we, as the vaccinated, we can still get the virus and share the virus, maybe without it even knowing it, if we're in a crowded situation. So my advice is that, again, think safely. If you're in an area where social distancing isn't possible, you need to be thinking about putting on that mask. So Dr. Taylor, maybe you could add in and then followed by Dr. Wong.
Sure. Yeah, and it's funny, to me, it's similar to what I was thinking as we talked about boosters and you talked about FDA approval for children. It's what we do. We follow the science and we follow the data. And the science and data say that masks protect you, whether you're vaccinated or not. Science says that if you're indoors right now with the community spread that we're seeing, the mask will protect you in those situations. Getting started on a vaccination series is better than nothing. But getting vaccinated obviously is helpful. Finishing your vaccination series, if you didn't finish your vaccination series, would certainly be helpful. So yeah, I would encourage people to follow the science, follow the data, do all the things that you were just describing, Dr. Vanderhoff.
Yeah, I agree with everything you suggested, Dr. Vanderhoff. I always get back to also just follow some common sense.
All right, thank you, Dr. Vanderhoff. It's now 11:59 a.m. So that was the last question we have time for today. If you would like to share any closing remarks before we conclude.
I want to thank again the physicians who joined me today, Dr. Wong and Dr. Taylor. I appreciate the time you took away from your busy clinical schedules to be with us and share some of these messages. And I want to again thank the members of the press for your attention to this important topic and for your efforts to share these messages among the people of the state. So thank you all very much.